How changes to healthcare might impact Arizona.
It could be pretty immediate next year, but it could be falling off a cliff after that.
Medical leaders hearing from patients.
What might happen if Congress takes away, for instance, the ban on pre-existing conditions? I have lots of pre-existing conditions.
Plus, how one health center plans to keep serving people. This is Arizona Week. Hello, and thanks for joining us. This week, all over the country, the Senate version of repealing and replacing the Affordable Care Act dominated the headlines. A bill that the Congressional Budget Office says will save billions of dollars while kicking more than 20 million people off of health care plans. In Arizona, that translates to about 400,000 people losing coverage and the state losing about $7 billion in federal funding. On Monday evening, Tucson Medical Center hosted a forum with half a dozen medical leaders in Arizona and about 600 people in the audience. Arizona Public Media's Zach Ziegler takes us there.
About 650 people packed the ballroom of the Doubletree Hotel across from Reed Park Monday night to learn about health care. Among them is Warren Deming.
Personally, I feel that health care is a right, that as a responsible community member, that it's important for us to have coverage.
Deming and others came to hear from a panel of doctors, health executives, and academics about possible changes to health care law. Their worries go beyond political and philosophical beliefs. Many are here because it could affect their livelihood.
And I'm very concerned about people losing their Medicaid, Medicare services, what it will mean to Pima County in terms of services for children, for the opioid epidemic that we seem to be experiencing here.
Well, in my own practice, I saw many instances of people having difficult times getting care. And since retirement, I've been working in a Southside free clinic, which takes people with no insurance, and it's even more difficult for them to get care, especially hospital care.
The event was put on by Tucson Medical Center. Hospital staff members say they've been bombarded with questions about the new Republican health care bills, so they set up this event.
And Tucson Medical Center, as an acute care facility and a health care facility, felt that it was our responsibility to bring people together tonight so that we could answer myths and theories with the actual facts.
Panelists answered questions about the Republican-authored bills, offering a general consensus that they would negatively impact health in a variety of ways. They expect cuts to the number of people covered by the state's Medicaid program, the Arizona Health Care Cost Containment System.
The House bill is estimated to lead to 23 million Americans losing their health coverage. The Senate version, 22 million, 300 to 400,000 Arizonans in all likelihood, and that's not going to be good for them.
Those cuts would come to a program that they say is lean and well run.
Arizona has been a model access program, a model Medicaid program. Efficient, fabulous outcomes. Just in our population alone, we've been able to drive down use of emergency rooms and unnecessary hospitalizations by about 25%.
State health insurance would not be alone. Municipal health departments would also lose funding. Pima County would lose about 40% of its health care budget if the Affordable Care Act were completely repealed, according to its director.
These problems that we face, whether it's adolescent pregnancy, whether it is low rates of immunization in some of our communities, whether it's how to respond to biological threats like Zika, all those things do not go away just because Washington thinks so.
The impact goes beyond those who receive government assistance or preparations for health emergencies.
Healthcare actually is a huge part of Arizona's economy. It's actually one of the linchpins to it, especially a linchpin to the economic recovery here over the last few years, and it's going to do great damage to it.
According to the state's most recent employment report, more than 300,000 Arizonans work in the healthcare industry. More than 10% of all jobs in Arizona are in healthcare.
So I would say a very conservative estimate would be that if these things went through, at the end of the day, we'd lose 20 to 25,000 jobs in the health sector in Arizona.
Organizers say they hope this event will spur the public into action.
We care for our community. We literally take care of Southern Arizona. So it is our responsibility to help people understand that they need to speak up.
Federal lawmakers have decided to wait until sometime after the 4th of July holiday to vote on the bill. There are patients who will be watching and waiting to see what lawmakers decide. Among those who could lose health care is Jerry Peake, a 60-year-old Tucson man whose health makes it difficult for him to work and thus have access to health insurance. Peake currently has medical care because of the Affordable Care Act.
For years, private insurance, I was self-insured or individual market. And then that was canceled, and I got on the marketplace and found one Obamacare plan last year, and then that was canceled and found another one this year, the only choice, but it turned out to be a good one.
Tell me a little bit about some of your health needs, because you do have some that have made it difficult for work and things like that.
Absolutely, yeah. It started with a withdrawal from a sleep medicine 4 years ago that was terrible, and all of a sudden I was very healthy and started having all these health problems. But I was really well taken care of by my individual plan and every other plan since. I have trouble sleeping, I have a bit of high blood pressure, that's taken care of. I think the most interesting or a thing that would help viewers know what has helped me recently, I slipped out of the bathtub and hit the back of my head, went into the emergency room, I was fine, then started having strange symptoms. Just a whole series, and I went to the emergency room twice more, and they couldn't find anything. And then I've had more doctor's visits since, and I'm still having trouble. A friend of mine, his wife is a physician, and she said, "You've got to just keep trying, Jerry." So it's been wonderful. I pay $75 a month with a subsidy. I'm basically retired and really low income. I'm concerned what might happen if Congress takes away, for instance, the ban on pre-existing conditions. I have lots of pre-existing conditions.
Was there a time in your life when you didn't have health insurance at all? And do you remember that anxiety of, what if something happens to me?
Oh, I was indestructible until that drug withdrawal experience. The time I didn't have health insurance was when I lived in London getting my graduate degree. And you could just walk into the doctor's office and be seen. Prescriptions cost £4, which is about $6. I was just taken care of. I almost forgot to come buy health insurance when I got back to the U.S.
Do you think about what could happen if the Affordable Care Act is repealed and replaced? What is your contingency plan?
I don't really have one right now except to be healthy. We'll see what comes up. For instance, if there are high-risk pools, I'm definitely a high risk. Insurance companies don't like me probably because I have so many medical claims, and I have no idea what's going to happen. Maybe Nogales is a possibility.
Would you be able to afford purchasing health care on your own?
Oh, the policies I had used to cost about $600 to $700 and went up maybe $150 a year. I just have no idea at this point. I'm older, I have more illnesses. I don't know.
Is there something else that really drives you right now to think I have to be an advocate for my own health?
Well, I'm getting older, and I think this last experience in the emergency room several times, I had lots of times to think while I was waiting for test results to come back, and I realized I've got to take care of myself really well. For instance, I don't exercise enough as much as I used to. Yeah, it's definitely a concern, and I don't know what's coming, but I watch the news a lot.
When you started to get the Affordable Care Act, was there relief on your end knowing that you had coverage?
Yeah, oh yeah. I was really concerned, but it turned out to be so easy. You know, no questions about my health. I didn't have to go back through my medical records for years and find everything. For instance, my former insurance company had a little bit of arthritis in my right shoulder from overusing my computer mouse, and so they put a total ban on coverage for arthritis. I couldn't even talk to my physician about it. So I don't look back to those times very fondly.
You're 62, you'll be 65, and then eligible for Medicare.
Right.
Do you feel like if you reach that point, then you'll be okay?
It seems that way. You know, you never know what Congress will do, but it sounds like it's not on their hit list because it's really important, and that's basically single-payer insurance, and it was wonderful in London.
Okay, great. Thank you so much. Children will be affected by changes to health care under the proposed bill. Throughout Arizona, Medicaid covers more than 630,000 children. Pediatrician Eve Shapiro says Medicaid is not only an entitlement program, but one that empowers families.
I don't know if people realize, but over 50% of children in Arizona right now receive Medicaid benefits. And if there are any cuts to that, children would be dramatically affected, as well as many very sick elderly people, people who are disabled. I think somehow people think people on Medicaid are kind of deadbeats, but if you look at the population, these are people that are vulnerable and that really need care.
Tell me about this population of kids on Medicaid.
These are young families, and the way wages are in our state, many people are on minimum wage jobs, and if you are working at a minimum wage job, you are eligible for Medicaid benefits because there's no way at that income level that you could afford private health insurance. And so many of these people are just starting out in their working lives, and they have young children, and they rely on Medicaid for the children to get care. And then if any children have any significant medical issues, care is very expensive, and they really rely on Medicaid for that, sometimes even as a supplement to private insurance, which has a lot of gaps in coverage.
You've been treating children for the last 30 years.
Right.
How does this affect those families, those children, their day-to-day needs?
Well, basically, if you can't get your kids in for care, it'll affect you as a parent. You may have to stay home from work. Often when children don't have insurance, parents don't get insurance for themselves. It seems to be a snowball effect. And so it's really better for the whole family when kids have coverage. And so this would be very devastating in our community.
How important is health care for children? I mean, these are things that we don't often think about, but they need regular
Right. Well,
access.
a lot of what we do is preventive care so that they grow up to be healthy adults. For instance, immunizations. People know how important those are to prevent diseases. When I first started out in pediatrics, I saw children die of diseases that now we never see anymore because of vaccines. So that's very important. Following children's growth and development to make sure there's no issues. As people may be aware, we're seeing a lot more children with developmental issues, autism, et cetera. Those have to be identified early so kids can get the services that they need. And so if children are not getting appropriate medical care, they will suffer. And this will affect their ability to be healthy as they grow older.
You mentioned that snowball effect. Can you talk about when you have that parent who brings their child in, they can't go to work, the child is home for the day. I mean, if they don't get that regular access to treatment, it just creates this problem throughout the community.
Right. And, I think that we want people to be productive members of society. So the way to do that is to provide health care for everyone so people can stay healthy, go to work, and do what they have to do. So we do see a lot of families relying on other family members, extended family members, but there again, those people need health care too. So it really has an impact on everyone in the community.
We're still deciphering the details of the American Health Care Act, but what in it that you have seen or that you've read really troubles you the most?
Oh, it's hard to pick one. Let me count the ways. So the Medicaid is a huge problem, Medicaid cuts. And the way they want to do it is by either capitation or block grants. And the basic idea is to cut the funding. I think on that side of the aisle, in the House and the Senate, they somehow see the Medicaid cost as a problem, that's the problem, is the cost of Medicaid. They don't see the benefit of providing care. So that's huge. The other issue is pre-existing conditions. Even though they put in some language for that, if people drop coverage for even 1 month due to job change or whatever, they can't afford coverage anymore, and that has a huge impact. Even in pediatrics, we see people with diabetes and other seizure disorders, other serious chronic disease. Those people need health care that's accessible throughout, not to be dropped here and there. The one slightly positive thing they did was to change the cost to the elderly that the House bill has, because in the House bill they could charge people up to Medicare age something like 4 times the price. The Senate bill isn't quite like that, but then it raises the cost for other people. So there's a lot of cost shifting. What we should be doing is providing access to health care for everyone.
You know, we've talked about repealing and replacing the Affordable Care Act and the impact it would have on families. How does it impact you as a physician?
Well, so if people don't have health insurance, sometimes we have to give free care. It's interesting, after my op-ed, someone wrote, well, why don't doctors just see people for free? I'm not sure he realizes that's pretty much 50% of the population, and we pretty much all go out of business, including all the hospitals, if that happens. So that's not a very viable solution. So we try to work with people to help them get access to appropriate health care.
At El Rio Community Health Center, physicians serve the most vulnerable and have done so since the 1970s. There are about 95,000 patients in the network. Most are considered low income. Dr. Douglas Spegman says the Affordable Care Act has been beneficial for the health center, and despite changes, it will continue to serve patients.
3 to 4 years ago, our uncompensated, so folks that had no insurance, that really was our charity care, was 30% of our patients seen. Under the Affordable Care Act, that has exactly halved. So currently 15% of people that we serve are uninsured. That number, if you translate it out, comes to about 10 to 14,000 patients who live in our community, who, if the Affordable Care Act went away, would again not have any health care coverage.
What are the effects? Is it job loss? Is it people out in the community who no longer have health care?
Yeah, so all that comes into play. So the real sharp edge of this legislation is in individual lives, and the premise of what the changes that are on the table, for instance, pre-existing conditions. So it's not just to sustain Medicaid at current levels, but also to ensure things like pre-existing conditions are still covered, to make sure that there isn't block grant funding of Medicaid. But if they do that, the cost to the individual and the cost to the community is huge, because it's as if you're invalidating the pre-existing condition. But how does that come back to us? So as a community, what happens then, someone who could have been taken care of in a preventive way now shows up in the emergency room, and the costs involved there are orders of magnitude higher. We as a community and as a state have said, okay, if someone shows up in an emergency situation, we'll pay for that. But it's just an unwise way of doing things, and it's quite frankly a way that puts people and people's lives at great risk to do that.
As a physician and as a businessman, you must worry about what this means for this community.
I do. I worry a lot. From El Rio Community Health Center perspective, as part of the National Community Health Center consortium and network, we're going to be there. So we stand firmly committed. We were there before the AHCA. We are here now in the current situation. And if the AHCA goes away, we'll still be here. And so for us, yes, very concerned. Primarily, we're concerned because we advocate for our patients and for our community. The concern is in the individual lives, that will be disrupted and possibly harmed by any change that would impinge on the care that they give. But as a system, we're prepared to be there, because our mission, our vision has always been to serve the whole community, but especially those who are disenfranchised from care, those who are underserved, those who, because of social determinants of health, economic conditions, personal conditions, have been alienated from health care.
Okay. Thank you so much, Dr. Spegman.
You're welcome.
Across the state, the Arizona Hospital and Healthcare Association is closely monitoring discussions surrounding a possible repeal and replace of the Affordable Care Act. Greg Vigdor is the CEO and president and says changing healthcare in Arizona will have devastating effects. Greg, thanks so much for being here. The American Health Care Act, what is the biggest issue with it with respect to Arizona?
Well, they have the House version and the Senate version, both have the same problem for Arizona at its core, which is does tremendous damage to the Medicaid program, which works really well here.
Moving forward, what would you like to see does the House bill and the Senate bill, neither one you like? Are there parts of it that could work?
We strongly oppose both. For 6 months, we've been arguing for a reasoned, bipartisan review of the policies and the problems that play with the Affordable Care Act. That's not what happened. We have a political bill, very partisan bill, and really there's very little to work with in terms of that. We've been encouraging the Senate to start over. They did not. So we oppose both the House and the Senate version and are really looking for a different path forward.
The AHCA goes through, how does it change the landscape in Arizona?
Well, again, it really does tremendous damage to the Medicaid program. It's an $830 billion cut using the House bill numbers, and you project that out to Arizona. Our Medicaid program, the AHCA program, came out with an analysis last week and says over 10 years it's going to do $7.1 billion in reductions in government financing coming into Arizona to help take care of people. That's going to translate also to hundreds of thousands of people losing their coverage, which is what we're most concerned about. They're going to end up having to go to the emergency room for care, which is not the best place to go for most of your care. And we're just going to see disastrous consequences in terms of patient care. We're going to see great damage to the healthcare system. We experienced this during the Great Recession. And we're going to see great damage to Arizona's economy. Healthcare has been one of the stalwarts of the economic recovery, and this does not bode well for our future if it passes.
What contingencies are in place should it pass and it becomes reality in Arizona?
There's very few contingencies in place at this point. I mean, we've been hoping for a different path forward. Only recently did we learn that the Senate is really going down the same path. I'd say mostly right now people are holding off on doing things. So the uncertainty is tremendous in my world. I think if it passes, then we'll start doing what we always do, roll up our sleeves and figure out how to get through it. It's going to be pretty hard. I mean, this is a massive, massive change.
It sounds, though, like this could translate into job loss and maybe facilities closing.
I don't think there's any doubt there's going to be tremendous job losses. I think there's a number of facilities, few want to come out and say it, are very concerned about their future if they see the types of numbers that we saw in the Great Recession in terms of hospital uncompensated care, physician losses. There's all sorts of collateral effects to something like this that really are devastating for hospitals and other healthcare organizations.
The Affordable Care Act, some say, is not perfect. Are there things that you would like to see changed that would make it better for our state?
Oh, it's definitely not perfect. It's always been a mixed bag. The coverage provisions in Medicaid actually was what has worked, and that's why we were so concerned with why are we taking away that when there's other things to work on. Really in Arizona, the hot spot is the exchanges, the individual and family market, and there's a lot that could be done to try to make that a better program. It's probably not what's in either of these bills, and we could really focus attention on that. We could also focus where the governor's office was last year, trying to figure out ways to take our Medicaid program and have it be more of a transitional program where people move in and out, and we're really trying to get that back to jobs. Of course, health is how you get to jobs, and so finding a way to make these things really productive rather than just what some might perceive as giveaways to people who don't deserve it.
Are there parts of Arizona that are more vulnerable than others when it comes to a replace and repeal?
The rural areas of our state are always more vulnerable, just the scale of what happens out there just because of their size alone, but many other factors as well, just puts them at risk. They're at risk right now. We're already working without any of these acts passing on ways to try to shore up our rural healthcare systems. If this passes, it's going to add to the threat, and we're just going to have to see what we can do about that.
The Medicaid population, I mean, these are folks with some real need. What happens to them individually if this passes?
There's a lot of people covered, hundreds of thousands of people, so of course there's lots of different people included in that. Essentially, the answer is to go to the emergency room when you need care. And then I said that's a very unproductive way to try to take care of people. What we also know is that a lot of Medicaid clients have special needs. We know across the board there are behavioral health problems that really need to be addressed, and they are also a challenge we're trying to deal with right now. Opioid addiction was declared a public health emergency by our governor a couple of weeks ago. This is an area where the coverage in the Medicaid program gets them into treatment rather than somehow just trying to take care of them when we reach a point where it's in crisis. We have so many cases like that within the Medicaid program, which covers the disabled. It covers our moms and dads when they're in nursing homes. Most people don't understand that. The effects of this is really not people that you don't know. They're actually your friends, your neighbors, your family. And I think people are going to discover that, unfortunately, if this act goes through.
It was here in Tucson that Governor Jan Brewer announced she would expand Medicaid under the Affordable Care Act. Strained from party lines, it was a landmark decision. 4 years later, CEO of Tucson Medical Center, Judy Rich, says it feels as though Arizona has taken a step backwards.
It feels like we are, and you're right, it is bittersweet because I was not a strong supporter of Governor Brewer, and when she came to meet with us and to hold a meeting at Tucson Medical Center, I had the opportunity to meet with her alone and tell her how much I respected her for what she did and for the decisions that she made to provide access to the state of Arizona. And as you and I both probably read in the paper yesterday, she talked about what it was like when she made a decision to withdraw coverage from people in the state. So she's an important part of all of this.
Did the AHCA somehow create this when so many people were brought into healthcare and now they could potentially be taken off?
I think you could draw parallels between the growth of healthcare. But what's interesting is at the very same time that the healthcare delivery has grown, the reimbursement for that healthcare per insurance company, per Medicare, has not increased because we've been challenged by the Center for Medicare and Medicaid to provide value, not volume. So all of our efforts in the hospital have been designed to keep people out of the hospital, to not be readmitted. You know, we're penalized if people are readmitted to the hospital within 30 days. So I think concurrently we've provided more access, but we've also been much better at providing value.
And that's our program. Next week, water in the desert.
We took the water that comes out of the washer, and instead of directly going into the sewer, he put a switch on it so that I can have it go out to the landscape.
My colleague Christopher Conover takes an up-close look at efforts to preserve a precious resource. From all of us at Arizona Public Media, I'm Lorraine Rivera. Thanks for joining us.